Hello, sir. Good afternoon.
Good afternoon.
How are you?
All well.
Okay, great. So, today we are here with you because we have some questions
Sure.
related to your profession. So, shall we start asking you some questions?
Sure.
Okay, great. So, our first question is that what is estimated blood volume in adults and peds?
You're talking about the cardiopulmonary bypass.
Yes.
For the pediatric and adult.
Yes, yes.
So normally we calculate there we categorize the blood volumes for adult females is 60 ml per kilogram. For adult male 70 ml per kilogram. For the pediatric, like we talk neonatal and pediatric. For the newborn till 10 kilogram is 85 ml. Above than the 10 kilogram we calculate 80 ml, and around 21 to 45 kilogram we calculate 75 ml per kilogram. Hope it's clear.
Yes. Okay. Our next question is that as you use or prime your CPB circuit with crystallite, is there any dilution effect on CPB?
Yeah, if we're going to prime normally we prime our circuit with a crystallite like an electrolytes. We use plasma lights, or we use a normosols, or some centers using the ring elected. The circuit was primed, the cardiopulmonary circuit was primed with the crystallite, and in adults its effect is like 25 to 30% effect, but in pediatric the effect of dilution is 50 to even 200%. There is effect. So why I'm asking you 50 to 200, because in adults normally for example adults patients whose weight is like 70 kilogram and male, so 7 sevens are 14, almost like a 5 liter volume patients having the blood volume, and if our circuit priming volume is like a liter. So if we dilute the 1 liter of crystallite with a 5 liter of the blood volume, it will not affect such the hematocrit, and the rest of the factor will not dilute it as much as compared if we have the pediatric or the neonate circuit. We're having like a priming volume 600 ml or 400 ml, and the patient's its blood volume is like 800 ml. So there will be 50% dilution effect. So might be you need to add PRBC, whole blood factors. So it depends how much the effect is there. So yes, there is effect of dilutions on pediatric and adults, and there is a huge difference of effect.
Okay. So, is there any oxygen consumption of tissue difference in adult and peds?
Yeah, there is oxygen tissue consumption different. Of course, for adults, the oxygen consumption for the tissue is around 2 to 3 mils per kg per minute. But for the pediatric and neonates is around like a 6 to 8 mils per kg per minute.
Okay, great. So the next and important question is that how you calculate CPB blood flow for adult and peds?
For adult and pediatric.
Yes.
For the adult, we normally calculate 50 to 75 mils per kg per minute. For the neonates or for the adults, for the pediatrics, for like a below than the 3 kilogram or 3 kilogram, 150 to 200 mils per kg per minute. 3 to 7 kilogram baby, we require 120 to 190 mils per kg per minute. For 7 to 10 kilogram, 100 to 170 mils per kg per minute. 10 to 30 kg in between, if there is a range between 10 to 30, so we calculate around 80 to 120 mils per kg per minute. If the patient's weight is above than 30 to 50 kilograms, so we calculate around 75 to 100 mils per kg per minute. Hope it's clear.
Yes. Okay. So we'll go to our next question, that is our last question of today's video. So it is that what is ideal mean pressure during CPB for adults and peds?
Normally for adults we always keeping around 50 to 80. If your mean pressure during the cardiopulmonary bypass has the mean pressure and is also the quality indicator of the good perfusion of the body. So keep around 50 to 80 is your mean pressure, is the ideally for the adult. For the pediatric and neonates, 25 to 60 millimeter per mercury is the ideal mean pressure during cardiopulmonary bypass, and it depend also with your the flow and your hypothermia.
Okay. Thank you so much for
Thank you.
giving your time to us.
Thank you
It
so
really
much.
meant a lot. So we'll end this video with these important and basic questions. Thank you so much.
Take care.
Bye bye.